What do H. pylori test results mean for GERD? If you are curious about how Helicobacter pylori test results relate to gastroesophageal reflux disease, you are in the right place. Understanding this connection can help you manage your health better. Helicobacter pylori is a type of bacteria that lives in the stomach lining. It is often tested when someone has digestive issues. For those living with gastroesophageal reflux disease, or GERD, the implications of these test results can be quite complex. When H. pylori infects the stomach, it can cause inflammation, known as gastritis. This inflammation can affect how much acid your stomach produces. If the infection leads to antral predominant gastritis, it may increase acid production. This could worsen your acid reflux symptoms. On the other hand, if you have corpus predominant gastritis, it might reduce acid production, potentially providing some relief from GERD symptoms. Research on the link between H. pylori and GERD shows mixed findings. Some studies indicate that having H. pylori antibodies, specifically immunoglobulin G antibodies, may slightly increase the risk of developing GERD. This suggests that a positive H. pylori test could mean a higher chance of experiencing acid reflux symptoms for some individuals. However, other studies do not find a significant difference in GERD rates between those with and without H. pylori infection. This indicates that the relationship is not straightforward. Interestingly, treating H. pylori can sometimes change GERD symptoms. For some patients, eradicating the bacteria improves heartburn and regurgitation, especially if they have antral gastritis. Yet, for others, symptoms may worsen after treatment. There is also evidence suggesting that H. pylori might protect against more severe GERD-related conditions, such as Barrett's esophagus and esophageal adenocarcinoma, particularly with certain strains of the bacteria. When interpreting H. pylori test results, it is essential to consider how they may influence stomach, acid levels, and GERD symptoms. A positive test indicates an infection that could affect your acid dynamics. Treatment decisions should weigh the potential benefits of eradicating H. pylori against the risk of worsening acid reflux symptoms. Understanding your H. pylori status can help your healthcare provider create a tailored treatment plan. This may include using medications that suppress acid production and monitoring for any complications related to the esophagus. In essence, H. pylori test results provide important information about an infection that may influence acid production and GERD symptoms. However, these results are just one part of a larger picture in managing acid reflux and ensuring long-term health.